The multiple mini-interview, MMI, is a common method used by medical schools and healthcare programs to assess candidates' suitability beyond academic achievements. Unlike traditional interviews, MMI consists of a series of short, structured stations, each designed to evaluate different attributes, such as ethical reasoning, communication skills, teamwork, empathy, and problem-solving. Because MMIs test both knowledge and interpersonal skills, preparation requires more than memorizing answers. It involves understanding scenarios, practicing critical thinking, and reflecting on personal experiences. Whether you're applying to a medical program, nursing school, or other healthcare profession, the MMI is an opportunity to demonstrate your professionalism, ethical awareness, and ability to think on your feet. Each station is time-limited, so candidates must be concise, clear, and confident in their responses. This guide provides common MMI interview questions, sample answers, and practical tips to help you approach your interview with confidence and poise. Question 1. How would you handle a patient who refuses treatment? Answer. If a patient refuses treatment, I would first listen carefully to understand their reasons and concerns. I would provide clear information about the treatment benefits, risks, and alternatives, ensuring they understand the consequences of refusing care. Ultimately, I would respect the patient's autonomy while documenting the discussion and informing the supervising physician if necessary. My priority is to balance ethical responsibilities with patient rights. Tip: demonstrate empathy, clear communication, and ethical reasoning. Respect for patient autonomy is key. Question 2. Describe a situation where you worked effectively in a team. Answer. During a volunteer project at a local clinic, I collaborated with other students to organize a health awareness campaign. We divided tasks based on strengths, held regular check-ins, and supported each other when challenges arose. By maintaining open communication and shared responsibility, we successfully reached our goals and improved community engagement. This experience reinforced my belief in teamwork and mutual support. Tip: highlight collaboration, communication, and achieving results through team effort. Question 3. What would you do if you witnessed a colleague acting unethically? Answer. I would first ensure I have a clear understanding of the situation and document any observations objectively. Then, I would address the issue by speaking privately with the colleague if appropriate, or report the behavior to a supervisor or ethics committee, depending on severity. Patient safety and professional integrity are paramount, so taking responsible action is essential. Tip: show integrity, professionalism, and knowledge of appropriate reporting channels. Question 4. How would you handle a stressful situation in a clinical setting? Answer. In a stressful situation, I would stay calm, focus on the immediate priorities, and communicate clearly with colleagues. For example, during a simulated emergency, I ensured tasks were delegated efficiently, kept track of critical steps, and supported the team to maintain composure. Afterward, I reflected on what went well and what could be improved. Staying organized and composed under pressure is essential for patient care. Tip: emphasize composure, prioritization, and teamwork under stress. Question 5. How do you approach ethical dilemmas? Answer. I approach ethical dilemmas by first gathering all relevant information and identifying the stakeholders involved. Then, I weigh the options considering ethical principles such as autonomy, beneficence, non-maleficence, and justice. I also consider practical implications and consult mentors or guidelines if needed. The goal is to reach a decision that is ethically sound and practically feasible while maintaining professionalism. Tip: use structured ethical reasoning. Mention recognized principles to demonstrate understanding. Question 6. How would you handle giving bad news to a patient? Answer. I would approach giving bad news with empathy, clarity, and sensitivity. I would ensure privacy, use simple and understandable language, and give the patient time to process the information. I would also provide support, answer questions, and involve family or support systems as appropriate. Ensuring the patient feels heard and supported is the priority. Tip: show empathy, communication skills, and patient-centered care. Question 7. Why do you want to pursue a career in medicine? Answer: I want to pursue a career in medicine because I am passionate about helping people and making a meaningful impact on their lives. I enjoy problem-solving, continuous learning, and working in collaborative environments. Experiences such as volunteering in healthcare settings have reinforced my commitment to this path, and I am motivated to contribute to patient well-being and advance healthcare knowledge. Tip: be sincere, specific, and link motivation to personal experiences and values. Question 8. Describe a time when you faced a conflict and how you resolved it. Answer: while working on a group project, two team members disagreed on the approach to a task. I facilitated a discussion where each could share their perspective, encouraged compromise, and helped the group reach consensus on a balanced solution. By fostering open communication and focusing on shared goals, we completed the project successfully. Tip: highlight communication, problem-solving, and conflict resolution skills. Question 9. How would you handle a patient who is non-compliant with their treatment plan? Answer: I would try to understand the reasons behind non-compliance, which could be due to misunderstanding, fear, or personal circumstances. I would provide education, explore alternative options, and collaborate with the patient to find a feasible solution. Respecting the patient's autonomy while promoting adherence through support and guidance is crucial. Tip: show empathy, problem-solving, and patient-centered care. Question 10. How do you stay motivated during long, challenging training periods? Answer: I stay motivated by focusing on my long-term goals, celebrating small achievements, and seeking support from peers and mentors. For instance, during a demanding volunteering schedule, I kept track of skills I was developing and reflected on the impact I was making on patients. Recognizing progress and maintaining a purpose-driven mindset helps me stay resilient. Tip: emphasize self-motivation, resilience, and goal orientation. Question 11. How would you prioritize tasks if multiple patients need urgent attention? Answer: I would assess the severity and urgency of each case using established triage principles. I would delegate appropriately and ensure critical tasks are addressed first while keeping communication clear with colleagues. This approach ensures patient safety and efficient workflow even in high-pressure situations. Tip: show clinical reasoning, organization, and prioritization skills. Question 12. How do you handle feedback from supervisors or peers? Answer: I welcome feedback as an opportunity to grow and improve. I listen actively, ask clarifying questions if needed, and reflect on how to implement the suggestions. For example, after receiving feedback on my patient communication skills, I practiced empathy-driven approaches, which improved my interactions and professionalism. Tip: demonstrate receptiveness, reflection, and proactive improvement. Question 13. What qualities make a good healthcare professional? Answer: a good healthcare professional demonstrates empathy, communication skills, integrity, teamwork, and adaptability. They also possess critical thinking and a commitment to continuous learning. These qualities enable professionals to provide effective care, build trust with patients, and contribute positively to multidisciplinary teams. Tip: highlight both technical and interpersonal qualities. Question 14. Do you have any questions for us? Answer: yes. I would like to learn more about how students are supported in developing practical clinical skills and handling ethical challenges. Additionally, I am curious about opportunities for mentorship and collaboration with senior healthcare professionals. Tip: prepare thoughtful questions to show interest and engagement. Closing thoughts. The MMI evaluates not only knowledge but also your ability to think critically, communicate effectively, and demonstrate ethical reasoning. Preparing for common scenarios, practicing responses aloud, and reflecting on personal experiences can help you perform confidently across different stations. Remember, the MMI is as much about demonstrating professionalism and empathy as it is about giving the right answers. Approaching each station with clarity, confidence, and compassion will help you leave a positive impression and showcase your suitability for a career in healthcare.